With specific reference to the footnote, though, because I think it's so important in terms of both symbolically and in terms of the incentive, it really speaks to this wider challenge we're trying to grip. At Policy Exchange, our assessment was that the footnote is not fit for purpose. And the reason that we came to that judgment is because if we look at what the footnote was meant to do when reforms were introduced in 2010, it was to kind of remove the system where it was, are you fit to work, yes or no, to what could you do with the right type of support, what are the reasonable adjustments that could be made to assist you. But in 90% of cases, over 90% of cases, individuals today are signed not fit for work. And in terms of the certification of fitness, you're absolutely right. In over 90% of cases, it is a GP that certifies the fit note, but over the past 3 years, we've expanded the range of professionals who are able to certify fit notes. And there's consultation, consideration whether that might be expanded further. So question for the future would be whether you would expand that, for instance, to paramedics and podiatrists on top of the physiotherapists, etc., who have been added. The reason we say not fit for purpose is because, as I say, first, in the vast majority, over 90% of cases, we are not directing people towards or providing information that would support their return to work. And the other challenge is that there's a tension between what employers want, what individuals need to some extent, and what healthcare professionals do. So, as I said, looking at the evidence, in 70% of cases, there is no diagnostic given on a fit note. So, actually, in terms of where we actually are able to identify the condition with which someone has been signed off, it is in only 30% of cases. So when we're talking about the increases, for instance, that we cite in the report, around about 7% increase from 2015 in actual specified diagnoses of mental or behavioural conditions on the fit note. So there's a significant information gap, and employers will say, potentially we want to do more, we may be willing to buy occupational health services, but we don't have the information in order to be able to actually support people effectively. Looking to the healthcare professionals, general practice trying to funnel a lot into a 10-minute appointment. It's the discussion we had about earlier. Often we're not just dealing with a health diagnosis here, we're dealing with a very complicated set of factors, social, occupational, which will determine someone's fitness for work. So what we have said is that we think that there's something about the importance of primary care in terms of trust, the trusted relationship that people have. So taking kind of the fit note sickness certification out of that setting altogether might not be the right step. But what we should be thinking about doing, and to some extent you don't necessarily want to change the mechanism before you change the actual supportive services behind it, but give the healthcare professional who is doing the certification of sickness the ability to effectively refer somebody to further assessment or ongoing assessment. So if this is a case that is complicated, where clearly there's a clear kind of indication that there is mental ill health, whether it's more to do with the vocational challenges, further assessment would be good, and that could be something that the employer provides from occupational health. Ongoing assessment is the other category which we thought would be helpful to introduce. This is for individuals where they're managing long-term conditions, where their conditions may exacerbate over time, and effectively they know that they would have to return, come for repeat fit notes, etc. Can we find a different way of monitoring them over time and looking at the process? So as a mechanism that kind of sits at this Venn diagram between employers, the welfare system, the individual, we do think there's something quite important in terms of rethinking it, how we can actually sort of achieve what its original objective was. And so it would definitely supportive of the previous government looking at that and thinking about what we could do to reform it. So we do hope that that work is taken forward. But just to absolutely also caveat the point that in terms of the specific discussion that we're having about the benefit system and welfare, it plays a small part, and it is often not the critical piece of evidence, as it were, used to determine someone's eligibility for health-related benefits. The role of the functional assessor and the report that they provide to the Department of Work and Pensions is the key thing here. And we've not, for instance, referred to the changes with the health assessment advisory service, which is now the range of providers who provide these functional assessment services for the department, but that's been a big change that's been rolled out since September to consider.
Yeah. Just